Healing is done by your own immune system and not by the surgery or by any medicine that you take. I was a student in the 50s in Madras, and opposite our big hospital, which is Asia's biggest hospital those days, there was a doctor called UL Janardhan Rao or someone, a Brahmin old man. When I was 17 years old, he was 70 years old. And he was practicing medicine then with an LIM, which he got 70 years earlier. LIM means they don't eat nothing there. But if we had 2,000 outpatients, he had about 1,500 outpatients. And his queue used to be from Parktown via Chinatown to the almost to beach. That was the queue in the morning. Every day, every day. The old man will have a stethoscope. Once I saw that, it's about a meter long, because he doesn't touch these patients. You know, poor patients, they smell and all, they don't take bath, he thinks. So he has an assistant who takes a chest piece and puts it on the patient's chest like that. And this fellow will keep it in the earpiece here. There are 3 rooms. Patients come in one room, he sits in the middle room, and the third room is on the other side. Every patient comes with a bottle. Those days there were no tablets. You know, when I was a student, we had only few mixtures. So they bring a bottle, put the bottle there, a big receptacle will be kept. And the thing is taken through the compounder's room to the other side. Compounder fills some medicine in some bottle, which is whose bottle is what, nobody knows. And that is taken to the third room, and when the patients pass out, they pick up their bottles and go. Very interesting thing happens. Patient comes in, he is ushered in, he says, Enna in Tamil means what? And by the time he opens his mouth, that fellow is, Jargandi, like in Tirupati temple, he is already Jargandi next. And in between, the chest piece touches the patient once. That's all what happens. And obviously, patients get better, otherwise they won't come back. Because he doesn't advertise. Those days there are no television to advertise, or there are no paper advertising saying, come here, we will do you'll give you a new foot, or we'll give you a new heart, nothing like that. Word of mouth. Patients from all over Chennai and the surrounding suburbs used to come to UL Narayan Rao. That impressed me a lot. As a young child, I was looking at UL Narayan Rao and appreciating, my God, he's God. Today, he is very scientific. Very, very scientific. My former chief in Harvard, who is 92 years old, still directs research, Saparwala Sahab. His name is Bernard Lown, who is a Nobel laureate. That shocking machine that they all use in the hospital, he invented that. He directed research about 10 years ago. What did he do? 600 patients over 5-year period were sent up for bypass surgery to the Harvard Medical School from the Massachusetts cardiologists. And they were doing laser tip bypass surgery. It's called total myocardial infarction. Nothing, no cutting the chest and nothing of the sort. Patient doesn't even know. You just put a catheter in and make holes in the heart and convert a man into a snake. Snakes don't have coronary system. They suck blood from the cavity through the holes. So we make a man a snake, and then he is okay. He said none of these people scientifically require bypass surgery. So he devised a new study. Patient comes, number 1, goes to theatre A. Patient comes number 2, goes to theatre B. C, A. Third patient. Fourth patient, B. Alternate patients at random. Close your eyes and randomizely do that. And the protocol in theatre A was anesthetize, operate, send. In B was anesthetize, keep him sleeping. When he wakes up, tell him he had a wonderful operation, send. Do nothing. Okay? 298 here and 299 here. Now at the end of 5 years, all these 299 who went to theatre B are perfect. Now thallium scan shows their revascularization is 100% perfect. In A, half of them, the chest pain did not go, so they had to have a cut open, regular surgery. The other half of the half are with their maker in heaven. The remaining half of the half, they are having ADR, adverse drug reactions, because of ticlopidine, aspirin, and what have you, all the blood thinners. They have had cerebral hemorrhage, this, that, problems. But those who went to theatre B are all happy. Now what happened to them? They were told at the end, when they woke up from anesthesia, your operation has been very successful. That's it. That's called the placebo effect. The body's immune system corrects it and opens up collaterals just as body does in all of us. Sitting here, all of us, including the children, we all have, mark my words, we all have coronary artery blocks. If you didn't have, you wouldn't be here. About 5% of human beings don't get coronary blocks and they die before the age of 25 of a sudden heart attack. This is called preconditioning. Nature preconditions. And the same nature does what it does.